Good morning. My study is titled Clinicopathological Patterns and Surgical Outcomes in Periocular Basal Cell Carcinoma, a retrospective study. Basal cell carcinoma is the most common malignant eyelid tumor worldwide, and BCC, a slow-growing tumor rarely metastasized, but if left untreated, can invade local tissues, and wide surgical excision with intraoperative margin clearance remains the primary treatment. Here is a clinical picture showing a firm nodular lesion measuring 5 mm into 2 mm on the left upper lid, and the lesion has rolled edges, focal crusting. There is distortion of the eyelid margin and loss of lashes, which is highly suspicious of basal cell carcinoma. The aim of my study is to analyze the clinical pattern, pathological subtypes, and management outcomes in patients with periocular basal cell carcinoma for better understanding and management of basal cell carcinoma. It's a retrospective observational study carried out from 2014 to 2025, and we have included all patients who were histopathologically diagnosed with periocular basal cell carcinoma with complete clinical and histopathological documentation. These were the data collected. Moving on to the results, we had 17 number of patients who were histopathologically diagnosed with basal cell carcinoma with a mean duration of symptom of 3.22 years with a maximum follow-up period of 120 months and a mean period of follow-up of 49.12 months. The mean age at presentation was 68.12 years, and there were no cases below the age of 40 years. In our study, there was a slight male predominance. At presentation, out of the 17 patients, 15 patients had primary lesion and 2 patients presented with recurrent lesions. Majority of the tumor measured less than 10 mm and the mean tumor dimension was 8.79 mm. Among the 17 patients analyzed, 100% of the patients had loss of lashes, 59% had surface telangiectasia, 82% had rolled edges, 94% had central ulceration. Lower lid was the most common anatomical site involved. Nodular type was the most common histopathological variant, and all the lesions in a study were pigmented basal cell carcinoma. Local invasion was seen in 4 out of the 17 patients, of which 1 patient exhibited perineural invasion. Direct closure was possible in 23% of the patients, but larger defects required flaps in 41%, grafts in 18%, and combined flaps plus graft in 18%. Lower eyelid involvement was most commonly seen in females and upper lid in males, but this was not statistically significant. Nodular BCC was predominantly seen in male, but was not statistically significant, and nodular BCC was commonly seen in lower eyelid and medial canthus, which was also not statistically significant. This is the case of a 53-year-old female status post wide excision and rotational flap reconstruction in 2022, now had presented with progressive increase in size of lesion. The first image shows a pre-operative picture showing a lesion in the medial canthus of the left eye with central ulceration and raised pearly edges, which is characteristic of rodent ulcer. And the second image shows intraoperative picture showing excised BCC with 4 mm clearance of margin with intraoperative frozen session, and the resulting full thickness defect was reconstructed with local cutaneous flaps and transconjunctival flap. And the third image is the post-operative image of the patient at 2 months follow-up. It shows a well-positioned flap. There is no flap congestion and necrosis. No recurrence at 9 months follow-up was noted. Moving on to discussion, the mean age of presentation was 68.1 year, shows increased incidence with advancing age. No cases below 40 years, which was consistent with the age-related risk pattern. The average duration of symptoms before presentation was 3.22 years, which shows a delay in seeking medical care among patients, and late presenters was 76.47% who attended the clinic after 6 months after symptom onset. Lower eyelid was most common site. It can be due to greater UV exposure. 11.76% did not demonstrate the classical clinical features, and the most common histopathological type was nodular subtype, which was in line with other studies. All cases were pigmented BCC reflecting higher prevalence in darker skin tone. Local invasion occurred in 4, of which one case showed perineural invasion, which is a rare but important indicator of aggressive BCC. Direct closure was limited to small defects, whereas larger periocular BCC mainly required flaps, grafts, and flap plus graft, which was in line with other literatures reporting flaps as the predominant reconstructive method. There was no significant association between sex, tumor site, or histopathological subtype, and recurrence was observed only in previously treated cases, which can be linked to incomplete excision. Complete tumor excision with 4 mm margin clearance with intraoperative frozen section achieved nil recurrence with a maximum follow-up period of 120 months and an average follow-up of 49.12 months. Our observation reveals that most evidence on periocular basal cell carcinoma comes from Western population, while Indian cases demonstrate differing trends. These population-specific differences highlight the necessity for detailed Indian studies to strengthen early detection, surgical planning, and recurrence prevention. The conclusion from my study is that basal cell carcinoma in eyelids can present even without classical clinical features, and hence suspicious lesions need meticulous follow-up and biopsy to confirm the diagnosis, and good functional outcome and disease-free survival is possible with appropriate surgical techniques and reconstruction. These are my references.
Any case had a resurgery? Any of these cases had a resurgery? You are seeing?
Sir, 2 cases were recurrent cases when they presented to us, and then we did resurgery, sir, and with follow-up period, none of the patients had recurrence again.
Okay. When you say like clinicopathologic patterns and surgical outcomes, it's a wide area. So we expect at least 20 tables. Like, those tables are not there. More nuanced looking into all the variables, all the subtypes, all that has to be done. And over time only, then you will know whether there is any recurrence, whether these flaps fail and become bad. All that also needs a continuation of the study and a wider patient selection. Okay.
How about the survival of this patient?
All the 17 patients are still surviving. Previous radiation therapy can predispose the patient to basal cell carcinoma. Yes, sir. No. Surgical excision is the primary treatment.
From the preventive aspect, do you like to say something? How to prevent this? Do you like to say something? Because you have done an extensive study regarding this.
Yes, ma'am. Increased ultraviolet light exposure, arsenic exposure, then immunosuppression predisposes to basal cell carcinoma. So we avoid.
Good presentation. Thank you.